Hi, I am Dr. B.B. Rao of Usha Clinic and founder of the websites qmedicaldoubts.blogspot.in and drraghavamedicaldoubts.in. Through these videos, I am providing the basic knowledge about the commonly occurring diseases, treatments and surgery details when necessary for the medical knowledge to general people and for reference to medicals. Today I am going to discuss about the cryptomenorrhea, congenital obstructive defects in the lower genital tract like non-canalization of the cervix, vagina or imperforate hymen leading to cryptomenorrhea. Actually, it is not an amenorrhea since the patients menstruate but without a visible menstruation. Cryptomenorrhea may be either congenital or acquired. Congenital. It is due to the failure of complete canalization of the lower end of the Mullerian duct in the region of sinovaginal bulb leading to imperforate hymen. Rarely there may be congenital atresia of the cervical canal. The patients are usually young girls with periodic pain abdomen without menstrual bleeding. The amount of retained blood may reach up to 5 pints and the abdominopelvic tumor is produced which is palpable and visible on abdominal examination. This retained blood is accommodated in the vagina as the cervix and the uterus offer considerable resistance to distension. Sometimes these patients present with retention of urine as the primary symptom. Abdominal tumor and bulging vaginal membrane, which is dark blue or purple color due to the retained blood. Gentle pressure on the abdominal tumor will transit a chill to the vaginal membrane and cause a bulge. Rarely, congenital cryptomenorrhea may result from a failure of canalization of the entire vagina through the uterus and fallopian tubes develop normally, causing hematometra and huntosalpinx. As soon as the menstruation is established, in such cases, abdomen is explored to confirm the nature of the tumor and the uterine cavity is opened and drained. Now the artificial vagina is constructed with a stitched skin graft from the thigh surrounding a plastic mold which has central canal. Before closing the uterus, an opening is made through the cervix into the new vaginal cavity so that menstrual bleeding can take place through the canal in the mold while the graft is taken. Successful pregnancy is possible with such an operation. Such miracles are going on in the medical field these days. Congenital absence of the uterus, tubes and vagina is more common in these cases. No expectation of menstruation or pregnancy, but many women with this defect of the entire Mullerian system retain all other isosexual feminine characters and a desire for marriage. The construction of artificial vagina is necessary and result usually in satisfactory intercourse. So in these cases, except the childbearing, all other feminine conditions are normal. After full investigations of the urinary tract to exclude any congenital urological abnormalities like single pelvic kidney, a cavity is made between the urethra and rectum up to the level of the rectovesical pouch of peritoneum. A polythene sponge mold is then covered with a single stitched graft taken from the inner aspect of the thigh and inserted into the cavity. After 4 months, the mold is removed and an adequate vaginal cavity remains. An alternative operation described by Williams involves suturing the labia minora together in the midline to form a cul-de-sac ending at the forechest. This operation is simple and provides an artificial vagina which functions satisfactorily. In long-standing cases of hematometra and later hematosalpinx may develop, and such advanced cases are however rarely met with as those of diagnosed and treated these days promptly. In spite of the distension of tubes and uterus, relief of the vaginal pressure usually results in complete involution, and pregnancy are reported by treatment with incision of the membrane. The contents of the hematocolpos are usually sterile and infective only after drainage. Treatment. With the modern chemotherapy, the occurrence of infection has become minimal. No vaginal examination should be made after the operation for several weeks, and no drainage tubes are used. The other is acquired cryptomenorrhea. It is man-made. Any operations like amputation of cervix and sclerothy are liable to be followed by stenosis. Cauterization. Cauterization by cautery or diathermy or even chemicals like zinc chloride, carbolic can also cause cervical occlusion. Radium treatment. Radium treatment for benign or malignant conditions is also responsible for a number of cases. If all these manipulations are preceded by cervical dilatation, the risk of occlusion is minimized. At the end of such operation, it is wise precaution to pass a sound to ensure an obstructed passage in the cervical canal. That's all about the cryptomenorrhea. In the next video, I will discuss about some other disease. Thank you.